So, hello, everybody. My name is Paloma Reynoso. I am a current child and adolescent psychiatry fellow at the University of Illinois in Chicago. So, I wanted to welcome everybody to the How to Do CAP Research Workshop, a diversity and equity and inclusion initiative sponsored by ACAP, the American Academy of Child and Adolescent Psychiatry's ABRSM grant. So this is a monthly series that aims to address the barrier to entry into research by providing an overview of fundamental research skills and showcasing the diversity of CAP research topics as well as mentors. So this series is intended for all individuals from all career stages, from medical students and residents and fellows. Um, and sorry, I lost my spot. Oh yeah, into the incorporation of equity, diversity, equity, and inclusion principles into research endeavors. So we hope to inspire individuals from diverse backgrounds to participate in research, to explore ACAP resources, and to apply to ACAP research opportunities. And so through this series, we feature diverse child and adolescent psychiatry researchers who share their wide array of research topics and um, career wisdom and introduce us to fundamental research concepts such as how to get started in research, how to find a mentor, how to develop your research ideas, and how to find financial support and grant support, and how to present and publish your work, and so much more. So this is scheduled to be an hour session, and we kind of start with learning more about a specific research mentor and their career trajectory, and using their own research to explain various concepts. So and then we will close the session by a discussion, by sharing just like overall pearls in how to engage into research. And so we'll reserve the last 10 minutes for a Q&A. And so during the session, I'm going to be moderating and looking at, any kind of questions or chats. So we highly encourage this to be interactive. And you can also submit questions anonymously by, you can send a direct message to me if you don't feel comfortable asking a specific question. And then this is a recorded session. I believe you saw the recording. So for our session today, it is my great pleasure and honor to invite Dr. Amalia Londoño Tobón. I've really gotten to know Amalia when I was a resident trying to decide if I wanted to do child, and was also interested in reproductive psychiatry. And so I think just having her as a role model has been really important in my career. So I'm very excited to be presenting and to learn from Dr. Londoño. So Dr. Londoño Tobón is a board-certified psychiatrist and researcher with expertise in perinatal, early childhood, family, and cultural aspects of mental health. She received her bachelor's degree in neuroscience from Johns Hopkins University and her medical degree from Stanford University. She completed her psychiatry residency in child and adolescent psychiatry at Yale University, and she additionally completed a postdoctoral clinical and research fellowship in perinatal mental health at Brown University, and a research fellowship at the National Institute of Minority Health and Health Disparities in the NIH. So she loves, she just like wanted to collect all of the fellowships. So Dr. Londoño's Tobón's work focuses on addressing mental health disparities in the perinatal period, promoting justice, equity, diversity, inclusion in academic medicine. She has authored several publications in scientific journals and is involved in writing and providing expert interviews for mainstream media. She has presented in numerous national and international venues. Additionally, she is interested in advocating for mental health topics, disseminating scientific information, and mentoring through social media, which is how she met me, through social media. I DM'd her on Twitter. So so we're so excited to have Dr. Londoño Tobón with us today. And Dr. Londoño, I will pass on the floor to you.
Thank you so much, Paloma. It's so nice to reconnect and see you here and see so many people that were able to join tonight for this session. And yeah, the power of social media. I'm going to be talking a little bit about that at the end and how mentorship comes in so many different ways. It is, truly an honor to be here. I've been supported through my career from beginning in medical school by ACAP, and it's really an honor to be part of this series. And again, to the power of ACAP, this grant and how this series came about, was in part an idea of Cindy, who's here with us today. And we met through social media as one of them, and then through the culture committee, and then we've been she mentioned this on a listserv, like, let's do something like this, and I quickly jumped, is like, how can I help, because this is such an important topic to make sure that we really are increasing the clinicians that are working in research in various ways, so that we can increase access and services for more individuals, and particularly individuals of diverse backgrounds and underserved backgrounds. Okay, so let me share my screen. And just as a disclosure, I am living what I am going to share with you, which is integrating. I felt, as I was, working on this talk, a lot of, what we do is integrating all sorts of things. And today I'm integrating being on call as an attending, integrating being here with all of you, and, really doing what I enjoy. One of the things I enjoy the most, which is mentoring. I'm trying to pass on whatever I can for, the next generation, and even my generation, whomever, and as I learn, I try to pass along things. And then being a mother of two little ones. So I am integrating as I'll speak to you. So just as a caveat, because hopefully I won't get pulled in any of these directions, and I can focus on today, but just wanted to make you aware that that's in the background of what's going on. All right. So just some disclosures of some funding that I currently have. And, I do want to start, the talk really talking about disparities exist in psychiatric workforce. Who is a psychiatrist? And this is, from an academic psychiatry paper, really showing that, this is the US Census, and, the percent of the population that is, Black, Hispanic, and here, different Asian American groups, are represented here. And then who is in a psychiatry resident applicant, and then, psychiatry faculty, and look at, really the huge disparities. Our workforce does not represent the population in the United States. And if we look more carefully at who is doing research, there are huge disparities in the workforce, and who is getting funded for research. And there's also huge disparities in what gets funded. And here is health disparities research and what gets funded. And, it's quite low in comparison, even though it has gone slightly up comparatively to other types of research. Really, there's disparities there as well. And I'm really excited you all are here, because we really need diverse perspectives to really best serve families and improve treatments for families. And so my journey looks like this or worse in terms of how I got to where I am right now. And it continues, I feel, to be that way. And I want to make a note that for a lot of people, it is that way. You're going to hear people's stories that seem, when you look at people's, research profiles, like it looks like a linear thing, or like, oh, they really knew what they wanted to do. But in reality, I would say most people, when you look at their path to research, and the ways that they integrate research into their clinical work, it's all over the place. So, I'll tell you my journey from undergraduate, doing really basic science, using mouse models for looking at specific neurodevelopmental pathways in mice, all the way to, what I'm working on right now, which is more implementation science. And, again, this theme of integration, one of the things that I've noticed, and I'll share kind of like how that happened for me, is that we really, have these silos in clinical care where we have, adult psychiatry, and then we have child psychiatry, and we have OBGYN, pediatrics, and primary care, and they're all kind of in their silos. And clinically, I've seen that, and that's kind of the work that I do right now to integrate some of these silos that exist, and really thinking about it from a health equity lens. And one of my passions is, development as well. And so as I talk about my career, I'll tell you about, I'm still in early stages. I'm an early career investigator. And, just as it is important, and some of the things that I study and I'm interested in are how susceptible this early developmental part is to environmental stressors, but also to environmental things that improve the environment that really can have a positive impact. Research careers are as well. So it's really critically important to get mentorship, get support, surround yourself with hopefully environments that are going to promote your development in research in whatever way you want that to be. And I really want to highlight that research comes in different ways, and all types of researchers and involvement in research is critical. So even though you may not want to be an independent, investigator, you may want to be a collaborator, or you may want to be part of studies, or you may just want to be critical readers of research literature. All of those are significantly important, and your role is really, really important. So you want to surround yourself by people and environments that will support your growth in that area. All right, so my journey. So I was born in Medellin, Colombia, and there's a picture of Colombia, and it's a picture of me growing up as a baby. And when we were in Colombia, we immigrated because of various stressors that were happening in my home country. And we immigrated to the United States, to Miami. And when we got to Miami, we had to endure a lot of immigration and acculturation issues. And I put that because, as you probably have heard in different talks, what we live through really impacts, what we do. And that, my experiences as an immigrant and my family's experiences accessing healthcare, mental health care, feeling very isolated, not understanding the system, even to this day, right? Like having to translate for my parents' stuff, interpret things, really made me realize, oh my God, there are so many things that are happening in the healthcare system and in general for immigrant populations. And the experience of, acculturating to the United States, understanding the culture, that definitely caused stress and continues to cause stress for my family. And, challenges, that we've experienced is in differences in acculturation, or what some people call acculturative distance between, for example, my parents and me, and also, I'm sure it's going to happen for me and my kids as we acculturate and are in different places of the acculturation process. That really influenced, me and my thinking process, and also my journey to research, because I didn't have the experiences that, for example, some of my other colleagues and peers had. I didn't understand the education system here, or how research worked here, or what it looked like to be a research. Like, how do you even become a researcher? Is something that I had to learn along the way. And I was very privileged to be in environments that were very rich and had really supportive mentors and colleagues along the way. But I think all of that really influenced my choices in how I went about things. And so I did my undergraduate, as Paloma said, in neuroscience and medical school at Stanford. And then, and throughout I did research and research concentrations. And then I did a residency that really integrated research into it. And I felt that I really needed extra research training. So I did a fellowship at Brown, and then I did another research fellowship at the National Institute of Minority Health. And I'm going to tell you across this journey how I integrated and how, what was going on for me at those stages. So hopefully some of the learnings that happened for me like resonate with you. So I put this here that, as I was entering these things right in the back of your mind, you're trying to, at least I was trying to like integrate like my personal and life experiences with my interest and my academic work. And, that's the path that I've been trying to do, to really integrate all these aspects. And so I was trying to, do the advocate, the community, the personal experiences, and the research and the academics. And ultimately, that coalesced into perinatal health disparities and research and access to care. All right, so for undergraduate, as I was telling you, I started, the way I got into research actually was that I had financial aid. And as part of my financial aid in undergraduate, I needed a job. And I went online and I searched for jobs, and then there was a job posting for being a lab tech or a lab support person. And I started ordering different reagents for a basic science lab in neuroscience. So in some ways I needed money, to pay for my expenses for school. And I wanted an experience that was valuable, that I knew I was interested in the brain. So I was like, okay, cool. So I got the job, and in my freshman year, and through that job, I started being very curious about research and what exactly was happening besides like just ordering the reagents. And I was able to do and support a project of medical student, actually an MD PhD student, that was working on a pathway, and a specific part of the pathway, a neurodevelopmental pathway, that if altered could really significantly alter brain development. And it, for that we were, working with pregnant mice and trying to understand, what was happening there. And then with that, that's my mentor, some of my mentor there. And with that, I started learning about, the NIH, and I actually applied for an undergraduate scholarship program, which is for a program that specifically supports individuals who are underrepresented in research and gives them scholarships to be able to attend college. And so I got it. Didn't get it the first time, got it the second time, and I got the opportunity to work at the NIH there for the first time. And then that was a great experience. And this is a great program that still exists, and I still have connections with the people in this program. And this gave me a sense of like I belong, and there are these programs that can support me, even though I don't have, any family members, really that know the path in this, And so at the same time, I was, trying to figure out, whether, that was the type of research that I wanted to do, but I knew I really was interested in advocacy in the community. So I worked with Programa Salud, which was, a volunteer-based organization from undergraduates, and I helped support, this program for bilingual volunteers, which we would trained in how to be interpreters, and supported interpreting services for communities, for patients in a community center that didn't speak English and needed healthcare. And then I felt very alone, because there really weren't any other people around me, or very few people that were Latino that I identify with, and also, or other, underserved groups. I felt very isolated. I was like, and also particularly in research. So, I started talking to through these programs in undergraduate to create a symposium for underrepresented undergraduates, to really get support in being able to do research and get mentorship on how do you do a poster, how do you get in this path of doing this. So, along the way I was doing that and trying to connect things. And then through this research, I'm going to thread as well, like how this kind of helped me in where I am right now, where I started learning that the perinatal period and this pregnancy to postpartum period is like really sensitive period of brain development. And I was starting to begin to understand also about caregiver development, but I was really fascinated by how like brain changes, were happening during this period. All right, so then I decided to go to medical school and applied to medical school. I actually applied MD PhD and got into some MD PhDs. But then, as I was doing the MD PhD interviews, at the time when I applied, the PhDs that people were doing were in basic science. And I just wasn't sure. I was like, I like research, but I don't know if I like basic science. I don't know if I want to spend 4 to 6 years, doing a PhD in basic science. So I ultimately, and that together with like some realities of like, I, you know, our family, came to the United States and was, struggling with finances. I'm like, I don't know, even though they paid for medical school, I'm like, I need to make sure I finish medical school so that I can begin earning money. I had this feeling of like, pressure of like, I don't know if I can spend 10 years just, not earning a salary that could potentially support. I didn't know if I had to support my family and my parents. And so I decided to get into medical school instead of accept a medical school offer instead of an MD PhD. And in medical school, I continued to be very interested. I actually thought I wanted to be a neurologist, but I had always been interested too in like pediatrics, I was all over the place. I was like, maybe OB, maybe pediatrics, maybe, and then psychiatry came up, and there was this, there was this wonderful program at Stanford that is the Klingenstein third generation program for medical students. And that's where I met one of my child psychiatry mentors, which is Dr. Shashank Joshi. And he is still mentoring me to this day, which is lovely. It's the power again of mentorship. And he had this course for medical students on child development. He's also a pediatrician. And I found it fascinating. And, through that, there was also this opportunity for doing research, and again, to pay for your medical school tuitions for a certain part to be able to do research. And I got connected with another wonderful mentor who I still talk to this day, Wendy Froelich, now Santino, who also was a child psychiatrist, who is a child psychiatrist, and also did pediatrics. She's a triple boarder. And she had a really cool project where they were following data from a large cohort of twins who had autism. And then I had the opportunity to create a proposal with her for the medical student ACAP fellowship. And then I got it, and I was able to, I learned how to collect data. I basically inputted all the data that they had collected on perinatal risk factors for the mom and the infant, and to be able to see if there was any correlation between that and on developing autism spectrum disorder. And that was neat, and it led to a publication. So I was like learning how to publish, how do you do basic analysis, thinking about cohort studies, thinking about genetic risks for autism. And that was the main goal of the study, but I was looking at environmental risks. And then I learned how to put my first small grant and learn, and this was all supported by these wonderful ACAP mentors. And then that's how I started to learn about ACAP. At the same time, I still had this passion of working with the Latino community. So I was very involved in the Latino Medical Student Association, and I was very, very interested in policy and how policy really shaped, how patients got access to different things and medicine. And so I helped develop the Health Leadership in Policy and Advocacy Institute at LMSA. And now there's, a lot of that LMSA work continues to this day, which makes me really happy. And I had a community of peers that, I felt I had a special and important bond with in a way that they understood some of my experiences being an immigrant, and really having a passion to support immigrant, and then the Latino community. And so, and this is kind of like some of the things that came out of that. And in medical school, I also had the opportunity to do more advocacy work with the Hispanic serving health professional schools, and was part of a congressional briefing, which also, was really important. And these things, again, seem like, why is she talking in a research talk about this stuff? And this is because these two things were really important to me. I was trying to do this academic work, and I was also trying to figure out, how do I do advocacy? How do I really do things with my community, supporting the Latino community, underserved community. So I was trying to figure out, how do I integrate this? How do I integrate this? I hadn't learned about health disparities research at this point. And then I also had some really important mentors in that that were pediatricians and psychologists that were helping me. And this is the paper that came out of that medical student work, really thinking about the risk, the risk for psychopathology for families, specifically children, during this perinatal period. And so I started to integrate all of this stuff. And then I was like, okay, I'm sold on child psychiatry. I love it, and I do. And I decided to apply to, I was triple board. And I was like, but I also want to do research. And then I also applied to some general psychiatry programs. And I had the great fortune to match at my first choice in a program where I could do pediatrics without necessarily boarding in pediatrics. I also had a T32, which is an NIH grant to be able to train in research, and R25, that is also a grant to train in research, all integrated to support some protected time to be able to do research, and all integrated with child psychiatry as well. So I was doing, across this 6 years, it was a longer training. Across the 6 years, I was being able to integrate all these things. And I was still trying to integrate research, academia, advocacy, and community. I'm gonna be telling you about different projects that I did, because that's how my path is, to do things and learn by doing. I think those have been really invaluable, because I've gotten a really wide spectrum of opportunities to learn from different people, and have been able to tap into different expertise of people and get support in different ways from various mentors. And honestly, that's one of the things that I love about research, this ability to really connect with others about shared interest and really make an impact on people's lives. And so Walter Gilliam, pictured here, was a mentor that he is a psychologist, but one of the things that I learned from him was that research is really important for research to have an impact. And he does research that really has huge policy impact. And I was like, oh my God, cool. This is something I want to emulate. This is something that I want to do. I want to do research that has impact. How does he do it? And he also does work on racial disparities in early childhood education, and how, unfortunately, Black children get expelled even at a very early age from daycare centers at disproportionately rate than white counterparts. And so I learned about racial implicit biases in preschool and teachers. And you see here, I was trying to integrate, okay, this advocacy, this community, and working with underserved communities in research. So I started beginning to do that. And this is Michael Block, a child psychiatrist who is, one of my biggest research mentors. And he is really, really good at meta-analysis. He's really good at systematic reviews, and he gave me a lot of opportunities to really learn a diversity of methods. He also does clinical trials. So I got a chance to work in clinical trials on ketamine, of ketamine in adolescent depression. And so, together, but he also was helping me develop my own research interests. And, with Michael, we started thinking, okay, how do I integrate this interest in implicit bias, racism, into something that is research that is something that I can really learn how to do. And that's how we came up with a study that actually was supported by the American Psychiatric Association Minority Fellowship Program, which you probably have heard a lot of this other speakers talk about, which I got in residency, and is a study where we, from the beginning, conceptually developing that study, to recruiting the participants, to doing my own analysis with support, to publishing it, has been, really a really wonderful experience. And actually, with Michael, we also did a similar study where we replicated the findings, where we found that there exists racial implicit biases in psychiatric providers, where psychiatric providers are pairing faces of what they perceive to be Black individuals with psychotic words as opposed to mood and disorder words, with antipsychotics as opposed to antidepressants, and also with non-compliance as opposed to compliance words. And so we wanted to understand, being a child psychiatrist and training in child psychiatrists, we wanted to see are these things happening too in child psychiatry and child psychiatrists, and with child faces. And what we found is that yes, these things are happening, and there seems to be a component. We looked at predictors of like what are some aspects of providers' demographics that could potentially impact and are associated with this implicit biases. And we found that training, the higher the training that you have, the more training that you have, there seems to be more implicit bias, higher implicit bias. And then that was even after controlling for the age of the provider. And so what we were thinking there, and this was published in Academic Psychiatry, we were thinking like, oh, wow, maybe they're in the medical system, we're training psychiatrists into these biases. And so that was something that really got us thinking. And then we were also looking at, provider reported race and how that impacted also their implicit biases. And we found that Black providers overall tended to have less racial implicit bias, specifically towards Black individuals in this. And we did replicate some of the findings in the child psychiatry cohort, and hopefully they're going to be accepted and they're going to be published soon. And so that was like some of the studies that I did, but then I was also interested in this aspect of development and thinking about this perinatal period. And so I got the great opportunity of doing a study and developing a study on a study that had already been conducted. And so this is another way that you can do it. If there is already a study in where you are, you can think about what can I do with the data that is already there, that's collected, and then also can I do an offshoot of that study in something that interests me. So the study that I worked with Dr. Arietta Slade and Dr. Lois Sadler was a study of an intervention that supported Latina and Black moms in particular in the New Haven community, where the intervention started in pregnancy all the way until the child was 2 years old, and it was a dyadic intervention, and it provided nursing support and social work support. And the intervention had already happened, but there was a cohort that was being followed. And I was like, I am interested to see how these kids are doing and these parents are doing all this time after the intervention has happened. And so and I was also very curious about biological markers as well, probably influenced by what I had learned in medical school and also in undergraduate, this basic science component of like, okay, we know that there are changes biologically that are happening. And then in the medical school work with the perinatal risk factors for autism, we had found that there seemed to be something relating to the immune function potentially of the offspring that maybe increase the propensity for autism risk. So I was like, what is going on with the immune markers of these parents, of these children, and also of the parents that after the intervention, do these interventions, can they have effects on these immune markers and on biological markers, and also on the long-term health of these kids. And so that's what I did. And for that, I developed a proposal with the support of my mentors, and I applied for an ACAP award, and I got it as well. And that's some of the work that influenced now my work. And then that's where I was trying to really integrate, okay, this is now an intervention and really serving communities that are underserved and are particularly meaningful and important to me. And then along the lines, I was still doing some like education work, and I was trying to do academic work and publish on things that were important. We developed a position of the Chief Resident for Diversity and Inclusion, and we documented that. So I put that to show that, research and academic and scholarship work comes in different ways, and you can be able to make your niche and do different projects and publish on them. There are ways to do that. And then I supported some of that curriculum. And along the way, I thought it was important to have these research mentors, but also clinical mentors and clinical experiences that really influence what I was seeing in the clinic, really helping me think through like what is needed, and remembering my own personal experiences as well, so that it could really serve to influence my what I did, the research questions that I asked. And so this is the study that we published on the school age effects of minding the baby, which is the home-based attachment-based intervention for parent and child behaviors. And then we also I'm talking here about, there were other interventions that I was looking at, which are, were influencing how I was thinking about it as well for preventing perinatal depression, and some that I was looking at. And this is, I explained a little bit more about the model here of minding the baby, and then the behaviors. And then we also, these are some of the specific behavior effects. And I think what was really neat about this, and we also looked at C-reactive protein, and we found that there were decreased C-reactive protein in the kids that had the intervention versus the control, which I thought was very cool. And I think what was very neat about that project is that I conceptualized the project. I recruited the participants. I did the analysis. I did the reporting of that. And that whole cycle of really seeing how to do that was incredibly helpful to be able to get a good foundation of like how to do research, and really like what to integrate. What are some of the challenges that come up with doing research with the populations that I'm particularly interested in doing research with, the Black, the Latino community, moms, seeing like what they were facing and the challenges. I was, at 8 p.m., collecting saliva from, kids. I was like, okay, you want to meet me at the library? Okay, let's meet at the library. You want me to meet you at your home? Okay. I got to really see the lives of individuals as I was doing this, and experience like some of the what they were experiencing, the research participants were experiencing, like, some of the moms were being evicted, and like they were, showing me what was happening, with their lives. So that was really, really crucial, as to learn how to do this work. And I learned that, through this research, that really this is a critical period, an optimal period for intervention, and to really have a positive impact on the trajectory of caregivers and child health, behavior, and biology. And then, I graduated, and as I was graduating, I was learning, like the project and that intervention had beautiful, amazing, rigorous results from an R01, which is, a really big NIH grant. And I found out that, that it wasn't being disseminated as much. And I was seeing that happen over and over with other, things in other research projects. I was like, oh my God, what is going on? All this research and all this investment, and it's not reaching the community, it's not continuing to reach the communities. And I learned about this, that that it takes 17 years to take 14% of original research for the benefit of patient care. And I was like, no, this cannot be. Like, I want to do something about that. There are enough, we know already, and you probably see it in your work. We know already that this research, like there are all these research, all these protocols, all these interventions, and they're not getting to the families that need them. And so then I was like, I need to learn about perinatal mental health, and I want to work on learning more about implementation. And so I decided to do a perinatal research fellowship, because even though I had a lot of experience on infant mental health, my program didn't specifically have clinical work with that, and I had not done really like as much the maternal part. And so I started working with other mentors on integration of mental health into obstetric care. And I was like, hey, I just want to listen in. How can I help? Can I help with anything? And I started learning about different ways of funding. And then I started, and then there was, this mentor at Brown, where I was like, she had some data from Latinas with depression. Okay, and we learned about treatment barriers and facilitators in pregnant Latinas with depression. And then she also had some stuff on maternal and father mental health. And I was like, yes, I'll do that too. And so we published on some work also on parents to underworld there. And then I met, Dr. Nancy Bayad, who's, one of my main mentors now. And I was like doing some projects on equity in obstetric care practices, and like system and practice level models to be able to integrate mental health and bring all this knowledge from clinical research into like real world settings, which is what she does. And as you remember, I did the undergraduate scholarship program for the NIH, and I had a payback year that I had to do. So I was like, I want to learn more disparities work. And through the NIH, I learned how to do, learn how to like think about large data sets. And I learned about the pregnancy risk assessment monitoring system, which is a huge data set, a CDC epidemiologic data set that collects a bunch of information, including now mental health, on different aspects of pregnancy and postpartum in the United States. And so I did some projects about that with that data set, and we found that there were disparities again in access to counseling and access to mental health. And so that served also as work that preliminary work to the work that I'm doing right now. And I also learned from Dr. Ananopoulos, who was my mentor there, the scientific director of NIMH, about this implementation frameworks to be able to really use community-based and in community-engaged practices to be able to do and implement behavioral health interventions and reduce health disparities. So I was like learning about all these different frameworks and my mentors and my mentors' work. Again, I was trying to like combine my interest. And I learned, across and with the PRAMS data, we learned that there were huge disparities in the treatment cascade for perinatal depression. And again, these are, only of 100% women, only like 40% are getting diagnosed, and then people are only 20% are getting treatment, and only like 5% are getting to remission. So it's like really, really bad. And if you look at disparities across the pathway, we know that when, even from screening, if you speak a language other than English, 26% less likely to be screened. If you have a Medicaid or Medicare insurance, you're 22% less likely to be screened compared to privately insured women. So I was like looking at the disparities, learning about all these things, and then, you know, treatment again, untreated. And if you look, again, 10% for Hispanic, very, very low disparities there, but half for Black and Hispanic moms. And less than 50% of the Black and Latino women with PPD symptoms, you know, reported access to counseling. And there were a bunch of system barriers, and I was learning about the system barriers and doing research, you know, collecting information from providers to really understand what were the barriers. So I was trying to figure out what can we do, and, you know, I was learning about system and practice level interventions and implementation and dissemination, and trying to integrate all these things within health equity lens. And I transitioned to faculty, and now I'm a perinatal and child psychiatrist and family psychiatrist. I put all of those because I feel like I'm all of those. And I also do research, and I'm in a women's mental health program, but I'm also in child psychiatry, and I work with different teams, and it's all about integrating these things. And I met my current boss at ACAP. So I'm just putting a plug there that ACAP is a great opportunity to meet your future boss. And I met him through the Health Prevention and Promotion Committee, and also through the Infant and Preschool Committee. And, you know, what I'm trying to do is really integrate these things. And I'm doing different lines of work at this point, including integrating mental health into obstetrics, integrating mental health into the NICU, thinking about global mental health disparities and integration of perspective and resources. And this is one of the interventions, the ones that I was telling you, system level integration, to be able to address this integration. And if you want to read about it, the psychiatry access programs are pretty cool. And then I want to say, like, as you have seen, whenever there's nothing, I try to create. And so I've always been very interested in global mental health, and I like work in like side projects. Oh, okay, there was a project in Colombia. I was like, okay, I'll help out with that. You know, even though I wasn't the primary person. And I was like, I want to do something now that I'm in a faculty position. I want to do something about perinatal mental health and global perinatal mental health, and particularly in Latin America. And so, you know, I was like, got a bunch of colleagues, you know, and we were like, okay, let's do a network of perinatal mental health in Latin America. And we have over like 550 members now. And we're trying to figure out, how do we do research in this? How do we bring all these concepts and learn from each other to be able to improve global perinatal mental health for families, both from mothers, fathers, you know, family system. And I continue to do advocacy work and try to increase services for the Hispanic community. And, you know, we have this page that we're working with the APL and lasaludmental.org with Spanish-speaking information. And then I put these considerations as I'm doing this. I was telling you how I'm trying to balance all these things, trying to understand the different stressors, experiencing different stressors, and trying to figure out how to navigate racism, sexism, feeling alone, feeling like an imposter still, trying to figure out funding, balancing independence and the need for support, and then pacing myself, you know, as I do this work. And so I put here some kind of, you know, as I kind of finish my journey, I put a couple of things. The path of being in research is rarely linear. Enjoy the road and the detours, because it really looks very much like this. Your perspective is unique and important. I remember I told somebody like, hey, I want to do research on like, or like, they were asking me, what do you want to do for research? This was like in residency. And I was like, I really think like building on my experiences and personally, like people are not connecting to care, like people navigating the complex system is like, I want to do something there. And they're like, that's not research. That's not research. And then later I found out that is research. You can do research on that. But so along the way, you're going to be told like, oh, that's not research, or you should, you know, that's, I don't know. You can do it. And your perspective and your experiences are important. My experience as an immigrant figuring all this out. And my parents too, clearly influenced me, and, it was an important perspective that maybe other people don't see. And there's multiple paths of being a researcher, a PI versus a collaborator versus an academician. There is no right or wrong. You just do your own thing and figure it out, as you go along. And the important thing is people are going to make you feel one way or another. The important thing is that you feel like it aligns with what is important to you. And you're going to find your people. Some people are going to be like, that's not research, or that's not how you do it. And it's okay. You take the advice, you listen to the parts that are helpful, and then you'll find your own people that are going to understand maybe what you want to do. And then relationships are key. You need mentors, strategizers, connectors, opportunity givers, advocates, allies, friends. You need all sorts of things. And so don't have like only one mentor, have many, have it for different reasons, and then mentorship is a relationship. It's bi-directional. It's really rewarding to be a mentor. And then it can be really rewarding to be a mentee. So be present, communicate with your mentors, let them know how you're doing, let them know if you cannot do something or what you're going, so that they can really support you in the process. And they'll really appreciate that you being prepared, or even letting them know what's going on. There is more to being successful in research than meets the eyes. Okay, so there's success and you see all these publications, but there's all these things underneath: rejection, passion, failure, doubt, fear, and so sacrifice. And I think it's really important to remember that when you see these people and you're like, oh, make it seem so easy. It's really tough. And support each other. It takes a village, it takes community, it takes collaboration. And lift as you climb. Any little thing if you can help another person, it can make a huge difference. And there's tons of resources, ACAP, there's grants. I mentioned the APA SAMHSA minority. There's loan repayment programs, which I also got, internal grants. Look at different listservs, join listservs, even if you just like kind of monitor. Try to go to committees at ACAP, search online for grants, keep track, ask people for their grants or and for their advice. And yeah. And I also wanted to mention, I also had the privilege of doing the ACAP DEI fellowship with JCAP, and it was amazing. So take advantage of all those opportunities so you can learn more about the scientific process, the publishing. It really opens your eyes to all the different things that go on there. And I met a lot of the people that you probably have heard from, Dr. Lisa Fortuna, Dr. Ujiko Jorogi, and Dr. Novins, who you'll probably be hearing from later. And then there's formal mentorship too. There's the Career Development Institute, if you haven't heard about it. There's also an international research training from this World Psychiatric Associations. There are 25, C32. There's APA Junior Investigator Research Colloquium. There's the ACAP Research Colloquium. There's the NIMH Outstanding Research Award Program. Again, keep a list of them, track them, and then try to apply for them. And then mentorship is everywhere. APA, Infant Committee, these are people. And then peers, and then social media. And peers are super important in this journey. I learn from my peers all the time. And these are, some of the colleagues, from my residency and from after that have really supported, that have given me opportunities. Hey, Amalia, did you know about this, or the other, and that has really been helpful. And then, here I put a couple of like the Twitter things that are out there. We have a very strong community on Twitter/X, and also on Instagram. And it's a great way to like, hey, ask a quick question, get support, and feel free to tag me and we'll tag you so that you meet more people. Paloma and I are happy to do that. And then I'm sure you already know about CAP MSR, awesome community too within the X space. So key points, early development is critical in a research career. Get support. There's health disparities research, as one avenue to do research. Not linear, everybody has their own path. Many ways to do research. Collaboration is key. Draw from personal and clinical experience. Do what fuels you. But sometimes the reality is you got to start where the opportunities are. So there's sometimes low-hanging fruit. Do it. And then there's a quote. I want to acknowledge all the people. And as you can see, there's a ton of people because that's the fun part, and that you learn so much from different people, and then you get to get support from so many people. It's wonderful. So thank you, and I'll stop there. And if anybody has questions, sorry, I went a little bit over.
Thank you. Thank you so much. Malia, that was awesome. And I learned, I feel like I know a lot about you, but I feel like I learned so much from your sharing your personal journey. Yeah, I'm really grateful to you, just to like have you as a mentor and colleague and friend. So it's
Thank
really,
you.
really
Thank you, Paloma.
and so yeah, if anybody has any questions, they have like 2 minutes that they want to ask Dr. Londoño.
And I'm
Um,
happy to stay over a little bit, whatever is helpful to people.
yeah. If anybody has questions, nobody has questions. I could also ask a question.
Looks like there's one on the chat.
Okay, yeah. Let's see. So I'm going to read it, the comment. So it says, thanks, Dr. Laloya, for your talk. I feel extremely identified with the process. I'm originally from South America and did pediatrics in Argentina, and I'm currently doing a residency at LSU, interested in a child. I feel like I do have multiple interests, and hearing you gave me the strength to believe that you can do all integrated. Oh, that's a very sweet comment. And yeah, no, I agree. I mean, like I was trying to decide between child and reproductive psychiatry, and then Dr. Londoño was like, "You can do it all." And now I'm gonna do both in my career too. So like, it's pretty cool. Yeah.
Yeah, I think I'm thank you so much for that comment. And I feel like people sometimes, and in research, you're gonna find some people that are like, you need to be more focused, you need to do this. And that's just not how I am. That's not how my brain works. It's not, and I think that's why I say, like, you build your own path. There's different ways. You'll find your people. I've found people that are not like that, either. Yes, of course, with time, I've had to learn, as well. And I've learned from my mentors to, be more focused. But I'm like, I cannot stop doing community work. I cannot stop advocating. It's just fun. It's what I like. It makes me happy. It fuels me, and it gives me the energy and strength to do other things as well. And, I'm trying to integrate it all. And it's not perfect. You cannot do everything at the same time. And now I'm, juggling, different priorities in my life. I've had to learn, well, everything, you can do it all. It's just at different times and in different ways, and that's just kind of do it. And the most important is to have support along the way.
Amelia, sorry, Dr. Lindo, if nobody else has a question, I can ask a last one. Like, how do you, I think especially as someone who I really identifies with having a variety of interests and also like competing like priorities, like balancing, um, being a mom. I mean, that's and a wife, and like all of those different aspects that are really important to me. I'm really anxious because I am, going to be taking an academic position. I'm going to be having an administrative role in my next role. And so, like, how do you find the time to balance your and clinical work, like the scholarship piece? Because I think that's where I really like, I feel like I have so many brain projects, and then it's like actually sitting the taking because I feel like if I take that if I don't set some kind of time I don't know, there's just everything else seems to be such a priority, like how do you prioritize like taking the time to like for writing? Like, I don't know if you have any tips for that.
Yeah. I mean, I think it's a process, an ongoing process. I don't think, I mean, this whole work-life balance thing it's not a thing. It's a process. It's not even a work-life balance. It's just juggling, you know, all of these different things. And I think you have to, what I've done in my experience is to um learn how to be kind to myself. That has been like a growth process for me, and like realize that um different times are call for different things and things that I want to prioritize, and realize that research in particular and in general are not on your timeline. They just happen. And for example, for the type of research that I'm interested in doing, it requires a lot of partnerships, a lot of collaborations, and it's not on my timeline. It's on working with different things. And so that's why I have like different things kind of floating around, because different things will pan out at different times, and you just kind of like go with the flow as to how it works. I do think it's really important to make sure, as you in whatever stage you're at, to find protected time as much as possible. And particularly in transition to faculty job, because different things are going to take clinical work takes a lot of time. And so finding a way to get that support through institutional grants, through talking to your chair about like having that protected time is really important. Joining other people's projects if you're not a PI, or you're not going to be an independent investigator, that could buy time for you to be able to do that. And if you're trying to integrate it with things that try to do things that and this is something that Dr. Jerome Taylor has taught me. Like, try that so one thing can hit multiple things. So if you're for example, I know, Paloma, from you that you're going to be also in a role of education. Can you do some education research, so that way you're kind of like doing something that's going to improve your that part, and then you're also going to be able to do academic work around it. So as much as possible, try to interweave things so that you're uniting things and not trying to do completely different things, because as your time gets less and less with different priorities, you just gotta integrate whatever you can.
Good advice. There's a couple of questions in the chat. And so this is from Amy Reyes. She says, I'm a student interested in policy and research that can inform policy. Have you been able to use your advocacy to change state or local policy successful, like, for example, Medicaid coverage for NICU psychiatry consults, or help inform policy as a consultant to legislators?
Yeah, I mean, I think that is what I'm hoping to do, but I'm really involved in advocacy efforts still. So, for example, I go to Advocacy Day with the Maternal Mental Health Alliance, and we're advocating actually for funding of the state programs that I was telling you about, the Access Perinatal Psychiatry Access programs. So that is kind of directly linked. And then the hope is that, as I get, more data from that work, we can inform more of those advocacy days so that we can continue to expand coverage in that. And then with Dr. Walter Gilliam, I was seeing how, policy at different levels can be influenced, for example, that the study that he did, and I supported with implicit biases in early education, that really influenced early education trainings. And for example, the work with implicit bias in psychiatry, we know that that's beginning to impact as well, psychiatry training, and, people being more aware of these implicit biases. And same for this DEI chief resident, now there's multiple places that have DEI residents. So influencing at different levels, but yeah, ongoing work. And I do think that this work, I mean, that's the goal, right? To be able to do research that ultimately will have an impact. So I'm very, very excited that you're interested in that, and continue to pursue it, because there's it's something that not everybody does, and so find mentors that you can learn from in doing that. Yeah, really important to learn.
Thank you. We have one more question. I think we probably should wrap up. The last question is, what is a good journal to start out publishing in?
I think that's challenging. I think it all depends on what you're trying to publish, and the the rigor also of your research. So I think there's specialty journals, there's journals that are more like wider audience, and so it really depends on what you're trying to publish, to be able to and fit the what you can do. But there's search engines that you can use to, for example, if you have a particular information that you have, you maybe have an abstract that you're working that you can put. You can just type on Google, for example, find a journal, and there's many of those, and then find and then it gives you a list of potential journals with those keywords. The other way to do it is if you're particularly interested in an area, look at similar papers that have similar content and see where they're getting published. Make a list, and that's a good way to start of like figuring out what journal to publish on.
That's awesome advice. So yes, we're gonna wrap up. Thank you everybody who stayed over time. Thank you again, Dr. Londoño, for spending time with us. It was, really amazing and very helpful to just hear about your career trajectory. And so thanks everybody for taking the time to join us. Please, I put in a link in the chat. Please take a moment to complete the feedback form to help give feedback and help us improve these sessions. And for everyone here, we invite you to join us next month on Thursday on May 16th, because we're going to have another research session with Dr. Cynthia Rogers. Hope everybody has a good and restful evening. Thanks
Thank
all.
you. And I hope it was very clear from the presentation, but feel free to reach out, in whatever way I can be helpful in your careers. It really is one of the things that brings me the most joy, feeling like, okay, I'm helping somebody along this path. So whatever I can do, please feel free to reach out.